Dr. Liou. It's an honor for me to talk with you about this subject, and I would like to know how the idea for Aramet, how was it born?
Okay, there's a long story to get started with. Since when I was younger, I read articles say if you do expansion wider, and then you can disarticulate or loosen the sutures better than only narrow expansion.
Okay.
But anyway, you are not able to really get a big expansion because there's some limitation. For example, the screw cannot be too long to put in the mouth because for cleft patient or some calcium patients, they might have a narrow palate. So then I started to think, yeah, maybe I can do like when we are doing tooth extraction. Because we've been told like when we do tooth extraction, that you will not only like rock the tooth to one side and you stop, right?
Yeah.
Of course, you're gonna turn back and forth, and until you can loosen the PDL, and you remove the tooth. So I apply the same concept to the suture, say, okay, I expand it, then I can put it back and expand again. So kind of like rock the tooth, and now I'm rocking the bone, and then I can loosen up all the sutures. So basically, that was the idea that I came from. So not a really big new idea actually that came from tooth extraction.
Okay.
Yeah.
Okay, doctor. You have a lot of papers, a lot of researchers, but I can find in you that you have an innovator doctor. I would like to know how can we think about to break the rules, to looking for new things to do in our clinical practice.
There are a couple of things like because actually when I was educated, first I was educated as an orthodontics. Then I went to Chicago for my craniofacial fellowship. But at the same time also I got into a program in surgery as well. So I kind of like, look at back to orthodontic from the surgeon's perspective.
Okay.
So then you're not looking the same thing by the way that we've been told before, because now I look at the thing from different aspects. When you're looking the same thing from different aspects, actually you are seeing different phases of that. So that is the first thing you don't just think in one aspect.
Yeah.
And you may change another role. For example, when you see things from the role of patient, from the role of surgeon, or even from anyone.
Okay.
And then you may think differently. The second thing is always a question about the current knowledge or technique.
Okay.
Always question, is that right? Is that correct? Can I do this? Can I do that or not? Why not? So I keep trying, and also very importantly, keep thinking, because actually it's not the doctor posting those questions to me. It's from the patient.
Okay.
The patient, they have questions, they have problems, so they come to you for help.
Okay.
So for example, they may say, oh, okay, I don't want to have surgery, I want that, I don't want this. So as the knowledge that we told before is, I said, no, this cannot be happen, because for your situation cannot be done without your surgery, for example. But after that, I will start to think, really, if there's some other way that I can do it.
Okay.
So I keep thinking, so maybe same question in my mind already for 10 years.
Okay.
It's not immediately like
Okay.
It's not immediate that it came out, pop up from my brain.
Okay.
Have been there for 10 years or even more years. Then one day, because I keep thinking that every day.
Okay.
So one day just pop out, say, oh yeah, then I have a solution.
Okay.
But that solution actually is very simple.
Okay. Yeah.
Because we tend to think it very complicated, and eventually, like that, actually is quite simple.
Yeah. The answer is not always so difficult. Yeah, I agree.
So keep thinking, keep seeing things from different way, and keep questioning about everything.
Oh, very nice, very nice. I saw your lecture on last year in Seoul, at Seoul, in Yonsei University. I really like it about the vertical development for club patients. It's really nice.
Okay.
Thank you so much, and I really appreciate your time with
Okay.
us. Okay, thank you.
Thank you very much. Thank